All right, welcome to The Explainer. Today, we're going to talk about a little pill that's probably in millions of medicine cabinets, and we're going to uncover a truth about how it works that I promise you is probably not what you think.
So let's just get right to it. Have you ever had a terrible muscle spasm or maybe just a really bad backache and you reach for a muscle relaxant? You're probably thinking it's going to go right to that spot and, well, relax the muscle. But is that what's really happening?
Yeah, we've all been there, right? You overdo it at the gym, or you're hunched over your desk all day long, and suddenly, bam, that sharp pain. Or maybe it's just that constant tension. And these are the moments when we reach for something, anything, to make it stop. And a lot of the time, that something is called a muscle relaxant.
You probably know the names, right? Flexeril, Relaxant, Soma. They're super common. You get them from your doctor. You might even have some in your cabinet right now. They're kind of the go-to for muscle pain. But here's where the story takes a turn, because how they actually work, well, it's one of the biggest misunderstandings out there.
Okay, so let's get right into the first big surprise. They're called muscle relaxants. The name says it all, right? They relax muscles. Simple. But what if I told you that's not really their main job? Let's peel back the label and see what's really going on.
And here it is. The common belief is that these pills travel through your body and act directly on that tight, painful muscle in your back or neck. But the reality? Nope. Their main effect is actually in your brain. They're not targeting your muscle at all. They're essentially sedatives that tell your brain to chill out, which in turn reduces the signals telling your muscles to be so tense.
This really gets to the core of it. You know how these pills can make you feel super sleepy? Well, that's not a side effect. That sleepiness is the main effect. It's how they work. By causing sedation, they're basically quieting down your entire central nervous system, and that's what brings the relief. The drowsiness isn't a bug, it's the feature.
So once you wrap your head around the fact that these pills are basically sedatives for your brain, it kind of opens up a whole new can of worms. It leads to an even bigger surprise, really, because it turns out the term muscle relaxant is this huge umbrella, and underneath it are two completely, and I mean completely different types of drugs.
So, on one hand, you've got the stuff we've been talking about. They're called centrally acting because they work on your central nervous system, your brain and spinal cord, to relieve pain. But then, on the other hand, you have something totally different, peripherally acting drugs. And these work way out at the muscle itself, and they're used to, get this, induce paralysis during surgery.
This just shows how wide that gap is. You might get cyclobenzaprine, that's Flexeril, for a muscle spasm. That's a centrally acting drug. But in an operating room, an anesthesiologist is using something like rocuronium, a peripherally acting drug, to completely paralyze a patient for surgery. It's wild. Two totally different jobs all hiding under the same, kind of misleading name.
All right, so to really grasp this difference, we have to go inside the operating room. Let's explore how these powerful surgical drugs, these neuromuscular blockers, literally flip a switch and turn your muscles off. The science here is it's incredible. So think about how you move a muscle, any muscle. It's actually a really cool little system. A nerve sends an impulse, which releases a chemical called acetylcholine, or ACH for short. Now think of ACH as a key. It travels to the muscle cell and fits perfectly into a special lock. Once that key turns the lock, boom, the muscle contracts. It's that simple. Key, lock, action.
Okay, so how do these surgical drugs work? Well, they are master imposters. They're designed to look just like the real key, the ACH. They can fit into the lock on the muscle cell, but they can't turn it. They're the wrong key. So they just sit there jamming the lock, and the real key can't get in. The muscle never gets the signal to contract, and the result? Total paralysis.
And what's absolutely fascinating is that this doesn't all happen at once. There's an order to it. The paralysis starts with the small, fast muscles like in your eyes and your face, and then it progresses. But the most important part? The last muscles to be affected are your breathing muscles, like the diaphragm, and they're also the first to wake back up. This is obviously a massive safety feature built right into how these drugs work. Okay, let's leave the OR behind and come back to the pills you're actually likely to find in your own home. Now that we know they're basically sedatives, we absolutely have to talk about the risks and how to use them safely.
This part is so important. Because they are sedatives, they depress your whole central nervous system. That means things like driving or using heavy machinery are a big no-no. But the biggest danger? Never, ever mix them with other things that slow your system down, like alcohol, opioids, or benzodiazepines.
The combined effect is way more than just the sum of its parts. It can be a fatal combination. And remember, these are for short-term use. We're talking a few weeks at most, not a permanent fix.
And these risks get even more serious for older adults. The sedation can cause confusion and dizziness, which, as you can imagine, dramatically increases the risk of falling. And a fall for an older person can lead to a serious fracture, which can be absolutely life-changing. This is exactly why doctors are, and should be, really careful about prescribing these medications to older folks.
Which is why a lot of experts are saying, hey, maybe we should look at other options first. Dr. Andrea Ferlin makes a great point here. Things like massage, heat, physical therapy, they can get to the real source of the pain. And the best part? No side effects. It's about fixing the problem, not just masking it with a pill that makes you sleepy.
So when you really get down to it, that name, muscle relaxant, is just not telling you the whole story. For the pills you take at home, it's really a brain relaxant. And just knowing that one simple fact changes everything. It means you can ask better questions and have a much smarter conversation with your doctor. So the next time you hear someone say muscle relaxant, you'll know the most important question to ask is, are we talking about one for the brain or one for the muscle?